So today I thought we'd learn a little bit about what is anemia and how can you know if that's something you might be dealing with. So anemia is never the final diagnosis. If we are dealing with anemia, it usually means that there is a root cause somewhere deeper that we need to investigate. So if you've ever been told you have anemia and started taking iron, but never found out why you had anemia, your journey may not be done. So, what is anemia? Anemia is when you either don't have enough red blood cells or you don't have enough hemoglobin cells to carry oxygen throughout the body. Since we need oxygen for every part of our bodily function, when we don't have enough, your whole body can be affected. The most common type of anemia is iron deficiency anemia. However, there is also B12 anemia, there is folate anemia, there's chronic inflammation or chronic disease anemia, and a couple of more. Iron deficiency anemia usually comes from a loss of iron. That can be from heavy menstrual cycles, blood loss, or poor stomach acid, chronic inflammation, because it prevents the iron from being absorbed in the body. Vitamin B12 deficiency anemia comes from a lack of B12 vitamins within the body. When we have low B12, then we have difficulty making new red blood cells. This can be seen in people who have restrictive diets, those who are taking acid reducing medications, as that also blocks some of the B12 absorption, and also digestive disorders or genetic disorders where you aren't one who is able to absorb and use synthetic B12. Common symptoms of anemia can be brain fog, dizziness, lack of energy, chronic fatigue, pale skin, shortness of breath, rapid heart rate, hair loss, brittle nails, cold intolerance or your hands and feet always feel cold, difficulty concentrating, poor exercise tolerance or recovery, and that's just to name a few. When I run all of my lab panels, I always make sure to include a full iron or anemia panel, looking at both your iron, your ferritin, which is stored iron, your iron saturation, B12 and B9. Though I may recommend patients to take iron when we start, we're always looking for what is the reason we're having iron deficiency and or why are we having anemia in general. So no, if your doctor has ever put you on iron but you're not really sure what did we do to figure out why I have low iron or low B12, then come on over to Access 2 and I'll be happy to help guide you in the rest of your way because anemia is not something you have to live with forever.